Hello, everybody. Welcome to our Glodum presentation of today, the misuse of skin bleaching products, causes and complications. So today we'll be having Dr. Mary Sommerlad and Dr. Chiedu Ufodiama. I hope I got that correct. So Dr. Mary Sommerlad is a consultant dermatologist in Hammertown Healthcare NHS Foundation Trust and the Portland Hospital for Women and Children. And Dr. Chiedu, a dermatology resident and researcher at Hammertown University Hospital and the Center of Dermatology Research at the University of Manchester. Welcome, Dr. Mary. Sorry.
Okay. Well, good morning, everybody. I think we should start as we go on. So, thanks for introducing Jamila. My name is Chiedu. I'm one of the dental registrars alongside, I work with Dr. Sommerlad in East London. I am going to share my screen now, I think. So if we can switch over, perfect. Okay, brilliant. Just a reminder, I think everyone's off anyway, but we'll have questions at the end, so feel free to comment as you do in the box, and we'll get those questions to you at the end, answers to you at the end. Okay, so misuse of skin bleaching products, causes and complications. Yeah, quick privacy notice. Please avoid recording and taking photographs of these slides. And we try to credit the images where we can. Okay. There are no conflicts of interest related to this presentation. And we start. Okay, so skin bleaching. Well, we all know, we're a global population, and we know that throughout our lives, there's always been a connotation or relationship within how dark our skin is, and maybe the opportunities that are available to us. That's something that's widely recognized, and this is kind of the inspiration of this talk, really, and it's kind of where we're going to with how we talk about skin bleaching today. All right, so what we're going to talk about today, we're going to talk about skin bleaching. What is skin bleaching? How it's bleached, why skin is bleached, the complications, and what we can do as dermatologists and healthcare professionals really to address this pandemic or epidemic of skin bleaching. Okay, so let's start off with some questions for everyone. What enzyme does hydroquinone inhibit? What is the annual value of global skin bleaching of the global skin bleaching industry? And what is the prison term for someone in the UK caught selling skin bleaching products? Okay, so what is skin bleaching? In some ways, skin bleaching is fundamentally the deliberate use of products to uniformly lighten the skin. So often some people may refer to skin whitening, but the main difference is that these are not medically prescribed treatments to treat conditions related to hyperpigmentation. Rather, they're designed to depigment, reduce that pigment of the skin. And how is it bleached? First of all, let's just get back to basics and a little bit of biology, a little bit of pathophysiology. So we know that melanin, the main pigment containing part of our cells, our skin, is produced by melanocytes. Now these are packaged within these vesicles called melanosomes, and then they are brought up to the skin surface using another cell called keratinocytes. Now in dark skin types, we know there's more of these melanosomes, and so we get the dark. So we have more of these mature melanosomes, so we get the darker pigment we see. And then light skin types, the ratio of these mature melanosomes are a lot less, and therefore we get more of a lighter pigmentation. And depending on where you are, you'll have different concentrations. Now, the process of making melanin ready for that pigmentation involves a chemical pathway using the tyrosinase enzyme that converts tyrosinase into L-dopa, which is dihydrophenylalanine. Okay. So as mentioned, tyrosinase is this key component, and that's something that we'll kind of circle back to a few times in this talk. And within that, we know that this pathway is so fundamental to pigmentation and to upregulation of melanin to mature into maturation. So just remember that, keep that in mind, and we'll relate it back to that as we go through this talk. Now, to disrupt melanin production, we need to target this enzyme, tyrosinase. There's many ways we do that. So you can inhibit the direct activity of it. You can inhibit that transfer, so the melanosomes moving up to the keratinocytes. You can affect the melanocyte environment, so literally the base of where the melanin is initially produced. And you can also use antioxidants to also impact the melanin activity or presentation. With that in mind, we can then consider the products that we use and how these products affect the environment where melanin is produced and pigmentation is seen. Now, all these products, most of them you will see over the counter, and we'll kind of drop through them as we go along. But we think about the ones who will inhibit that tyrosinase activity. We have products that will kind of downregulate tyrosinase itself. The ones who affect the melanocyte environment, the antioxidants and the melanosomes. And you can see some of these you're familiar with, you probably get over the counter. Ascorbic acid is also known as vitamin C, but we'll go through those as we continue. Okay, now commercially, these are the products that we typically see. Super potent topical steroids are very commonly known to be involved in products that are designed to lighten or whiten the skin. Hydroquinone as well. Quite commonly, mercury may be seen as contaminant, but also has been known to be used for skin bleaching, and then botanicals as well. Hydroquinone. Now, hydroquinone is probably the most researched agent for skin bleach and skin lightening. It is used medically as well as off license, and we know in the medical field that 4% hydroquinone is considered the gold standard, really, the thing we go for treating conditions of hyperpigmentation such as melasma. Now, it is known to be highly irritant, so there's often guided regime for patients to use when applying it, when using it for melasma and other hyperpigmentary conditions. However, in the UK, since 2001, it's been banned unless you've got prescription. Globally, and you may find hydroquinone available at a lower dose concentrations, about 2%. But unfortunately, as mentioned, if you go to the right or to the wrong place, I guess, you'll find under the counter and online resources where you can purchase hydroquinone for different concentrations, and the higher the higher the concentration, often the more harmful it can be. It's important to know that when you do see products that may not say they contain hydroquinone, they may describe it by its chemical name, which is 1,4-dihydroxybenzene. Now, as Dem told us, there's no denying that we enjoy topical steroids. We use them for many things, including inflammatory skin conditions. With a very potent topical steroids, they have a secondary effect when inappropriately used and used for a long time, and that is to disrupt the melanocyte environment. How that works is often due to the vasoconstriction and suppressing cytokines. So these are chemical mediators that reduce that control that UV related pigmentation. Potent steroids, super potent steroids and potent steroids are very much unavailable in the UK without a prescription. But again, unfortunately, quite often you can purchase those under the counter in some establishments as well. In other countries, I think that topical potent steroids are more easily accessible, and can often lead to challenges as well. So I know there's a product called Funbact or triple action that's often used, which can lead to a similar kind of adverse effect if misused. Mercury is one of those agents which has been there for a long time. It's historic, and we'll talk a bit more about the historic nature of skin bleaching, but it really works by inhibiting the tyrosinase enzyme, and that's by competing the copper. It works well. It's very potent, so it will lead to that hyperpigmentation. It's cheap, and because of its toxicity, it's generally banned in most countries. Some countries where it's not banned, you can often find it produced. These include Bangladesh, China, Dominican Republic, and Jamaica. Again, this is just a quick highlight that you never know what you find in all these under-the-counter products, and it can lead to quite a lot of adverse effects. So it's really important to discuss, to be aware of that when you are looking at products that advertise as lightening the skin. Moving on to botanicals, we're now in an era, especially in the UK, where people want to use chemical-free agents for their skin. Kojic acid, galabridin, which is from licorice, citric acid, lemons, or citric fruit, azelaic acid, and arbutin, all common products that you may see in products designed to treat hypopigmentation, reportedly treat skin lightening, support skin lightening or skin bleaching. Arbutin is one that we just want to highlight because quite often it can be used to mask the involvement of hydroquinone, and there's evidence to suggest that where hydroquinone is present with hydroquinone, it can potentiate, so make the effects of hydroquinone more stronger, and lead to greater adverse effects with hydroquinone. So how do we, or what's the routine for skin bleaching, and how do people use it? Most commonly, and in fact, you'll typically see people using it as a cream, a gel, or a lotion. Soaps have been known to be used, and often patients will use that once, twice daily. It's important to know that continuous use will lead to inhibition, but if you stop it, it will reverse. Most commonly, you'll see it in adolescents, and again, that may be cultural, societal, or pressure. And you may often see women who get hyperpigmentation during pregnancy being involved in it, using it as well. Now, although skin bleaching is wildly common in all parts of the world, there is some stigma related to it. So it's very unlikely that patients will disclose to you directly that they use this product. So always act sensitively and always be mindful of where you're going with it, or the conversation. Right. So now we've got some perspective. We know what's going. We know kind of how skin bleaching occurs. Why is skin bleached? It's complex. It's really complex. There are multifactorial reasons, and this can be linked with, your social status, wealth, and obviously often the remnants of the transatlantic slave industry and colonialism. There's a hand raised, but I think we're taking questions at the end. That's okay. The other thing we'll talk about is colorism. Colorism is cultural. I'm from Nigeria, Nigerian heritage, and colorism is present. In the UK, colorism is another factor, and it's something that we all need to be mindful of. And that colorism is fundamentally often within cultures where, depending on your tone of your skin, you may get opportunities which other people may not. Taking it back to the old school in some ways, we know that skin lightening has been something that's happened throughout time. First of all, we think about back in the ancient Egyptian times and Greeks and Romans. Again, the pale skin was associated with high status, high wealth. Basically, the idea that you didn't have to work doing laborious jobs to earn your money. So therefore, you were indoors. You weren't seeing the sun, so it defined you being wealthy, strong, wealthy of high status, and often considered more beautiful, more attractive. As mentioned, mercury has been used for a long time, but also other poisonous components such as arsenic and lead can be seen. Skin bleaching is literally, you can see it from Egyptian time and how it's progressed through our society going forward. Bringing it to lead. Now, lead was commonly used in makeup from the Egyptian times. It's often to whiten the face, but there's although effective at doing that, it can lead to quite severe side effects. Most notably, the dry skin, the abdominal pain, constipation. Unfortunately, although it may make your skin look white, it can often age you with grey hair. And often lead poisoning is associated with muscle weakness, paresthesia, and at worst times, death. Now, just a bit of a cultural makeup for you guys. The Venetians loved lead. They mixed lead with water and vinegar, and they give you this mask. Obviously, this is Queen Elizabeth I, and this is how she used to do it as well. Moving on to arsenic. Arsenic was again another potent chemical. It's used for different things. Obviously, back in the day, it was also used to treat psoriasis. But important is arsenic is very toxic. It can lead to skin cancer, dyspigmentation, bladder cancer, and liver injuries, liver disease as well. It does affect fetuses, so those babies that are yet to be born. So it's important to discourage anyone from using these kind of products. Again, just another note of history for you to be aware of, where people have used mercury and other skin lightening products, particularly in the 19th century, to give this kind of aristocratic appearance of paleness. They don't have to work hard for my money. And at this point, I'm going to pass over to Dr. Sommerlad, who will talk more about skin bleach from a global perspective.
Great. Thank you very much, Chiedu. Can you all see my screen, starting with skin bleaching in Asia?
Yeah.
Perfect. So we're going to move to the present day, and it's going to be a bit of a whistle-stop tour of different continents around the world, just to give us a bit of a cultural perspective. So in Asia, which is obviously the biggest continent in the world, fair skin is considered a beauty ideal amongst some. And it's important to stress that these views that we're describing are not held by all, and actually that there are really high profile vocal critics of skin bleaching. So this is Priyanka Chopra Jonas. She's a huge global star, and she has spoken openly about why she dabbled with skin bleaching in the past, including personal use, but also in an advertisement. The skin lightening industry in India is worth $500 million. In surveys, they found that about 60% of North Indian women are using skin lighteners, and 50% of the skincare market is around skin lightening. In colonial times, we know that British officers gave lighter-skinned Indians better jobs based on racist theories around European supremacy, and shared this ideal of a common ancestry with Aryans. So it's quite it goes back quite a long time. We know in East Asia, skin bleaching is actually quite an openly discussed. Again, it's a multi-billion-dollar industries. You'll see lots of products having the title whitening in the brand name. We know that glutathione injections, which have been associated with quite severe um, drug reactions, were quite popular, particularly in South Korea. They've been banned in several places. We know that in the South Korean representation of darker skinned people in music and acting is actually really low. And there have been stories in the media about people who are in the K-pop industry being mocked when they've got tanned skin or if their skin is looking darker. Um, there are even some contractual bans on performers about not having tanned skin while performing. And it's really common to have filters and beauty apps that show skin lightening. Skin bleaching is a booming industry in Africa, despite the sale of skin bleaching products being banned in many countries. So we know very little about skin bleaching in Africa prior to colonial times. We know that during colonial times, colonial officers who were from white European heritage um, would create artificial divisions of groups of people based on skin tone. So these were divisions that didn't really exist before colonizers appeared, and these divisions were based on skin tone. So those who had lighter skin tones or more European appearance were given preferential treatment, maybe better job prospects, and general better treatment. And despite colonialism ending for most countries at least 50 years ago and more, the association of light skin and beauty and success in the workplace still persists, even amongst younger people who were born well after colonial times ended. So, um, this is a popular actress in South Africa. And I think the interesting thing here with Kiani Mbu is her skin has visibly lightened over several years. And she talks openly about bleaching her skin and colorism. Um, but interestingly, she doesn't really mention the risks of skin bleaching. So she'll say, if you have lighter skin, you get better prospects, but she doesn't talk about any kind of particular risks. We know that um, in terms of figures. And again, many of these studies are quite small studies. And again, it's very difficult for people to agree or admit openly in front of a researcher that they don't know that they are skin bleaching. But from small studies that have been conducted, we know that about 75% of women in Nigeria have used skin bleaching products, and the figures range from between 30% up to 60%, depending on where you are. We know that actually, a lot of people are using skin bleaching agents in order to treat post-inflammatory hyperpigmentation. So this is dark marks after having a condition like acne or eczema. Um, so that's the majority of people buying things, but about a third are also using bleaching to deliberately, uniformly lighten the skin. Many countries have actually banned the sale of skin bleaching products throughout the continent. However, you can still get hold of them very readily available from street vendors and cosmetic shops. So, skin bleaching in North America and the Caribbean. It's really difficult to get accurate kind of statistics on how many people use bleaching and why they use it. In North America and the Caribbean, um, we think a lot of it is to do with the legacy of the transatlantic slave trade. We know that transatlantic slave trade led to a range of lighter skin tones amongst people with African heritage due to children being conceived between slaves and slave owners. And it was a huge advantage during this terrible time to have lighter skin if you were born into slavery, because it implied that you had a mixed European heritage, and therefore you were sometimes given lighter work, indoor work, perhaps but living in much better accommodation. And you may have been given other benefits such as skilled trades to learn when you had lighter skinned compared to your darker skinned counterparts. Studies have shown that discrimination based on skin tone, referred to as colorism, still persists. And we know research in America has shown that those people who have darker skin are more likely to be suspended from school for equivalent misbehaviors as their compatriots who have lighter skin tones, and they're also more likely to receive longer prison sentences compared to people committing a similar crime but with lighter skin. So now on to Europe. Europe is a huge melting pot, and we know that amongst non-white Europeans, so people who have come to Europe from Africa, Asia, the Americas, you can still get hold of skin bleaching agents really easily from lots of different sources. And the people who have immigrated to Europe will bring their own reasons for why they would bleach. So for some, it may be economic, for others, it might be a cultural or a beauty standard. So the important thing is the reasons people will bleach vary from ethnic group to ethnic group and culture to culture. So it's an absolutely booming industry worth about £24 billion per year, and it's only rising. And we know that with social media, there's a huge impact between people looking at different images online, following different influencers, and a desire to bleach their skin. But we know that skin bleaching isn't the same as dyeing your hair a different skin color. It has, dyeing your hair a different hair color. It has really severe complications. And a lot of people who are bleaching their skin regularly do not know about these complications because they're often not discussed. So first of all, hydroquinone, which Chiedu has already spoken about, really it can cause a severe complication called exogenous ochronosis, where you're left with dark marks on the skin that are impossible to treat, really difficult, because you're getting deposits of an ochre or a kind of browny olivey coloured mineral in the dermis of the skin. So to treat that, you would need to get through several layers of the epidermis and potentially leave scarring. So it's really, really hard to treat. So once it's there, you can imagine someone's decided to use a skin bleaching agent either for perceived beautification of the skin or to treat post-inflammatory hyperpigmentation, and they're left with this permanent complication. Also, there are other important complications to know about. Probably the commonest one I see is the irritant dermatitis, so kind of an eczema. Um, this eczema will look almost like a follicular or papular pattern. It's usually limited to the areas where the hydroquinone is being regularly used. And as dermatologists and people working in dermatology, what you're finding is the patient, you're giving them steroids, they're not responding, or there's only a short period of response, and then the dermatitis is coming back. I always try and look for other signs with these people who have this kind of very persistent facial or upper chest dermatitis. Sometimes they might have a violaceous tone to the skin. Sometimes the skin on the face is very different to the skin on the hands or on the limbs. So I will always do a full skin examination, explaining that I'm looking for signs of dermatitis in other parts of the body. There can also be an itching or burning sensation to the skin that's difficult to kind of explain the cause of. So unless you're thinking of someone who's using hydroquinone often, you might misdiagnose them with having a neuropathic cause. And then there's fish odor syndrome, also known as trimethylamminuria, and it's been reported when people have been using high amounts of hydroquinone for long periods of time. So this might be using hydroquinone top to toe for several years. And what's happening is the hydroquinone is inhibiting one of the ways that we oxidize trimethyl amine N oxide. It only happens if you carry a defective gene. So that's why not everyone is going to get fish odor syndrome. But if you have someone who has a fish odor, they're presenting to dermatology, maybe they've got irritant dermatitis, or you suspect skin bleaching, it could be that they're one of these people who carries the defective gene. And then finally, it's really important to say a lot of people will, because they don't realize that there are risks with skin bleaching, they will continue to bleach their skin even during pregnancy for women. And we know high doses of hydroquinone can be associated with fetal growth restriction. Then clobetasol, as Chiedu mentioned, as dermatologists, we love topical steroids because when used correctly under the supervision of a healthcare professional, you can really help treat a number of dermatological conditions. However, there are many important side effects. And for the purposes of this talk, it's important to know someone who is skin bleaching may have a kind of a weird constellation of symptoms that don't seem right. So maybe they're getting the irritant dermatitis with a bit of tinea and folliculitis and striae. Maybe they're getting poor wound healing as well. So think clobetasol. Clobetasol can be mixed and blended in with your hydroquinone as well. And we know that if you're using 50 grams of clobetasol per week for several months, you can actually induce Cushing's syndrome, and this can be an urgent endocrinological emergency. Moving on to mercury. Mercury, funnily enough, although to me it sounds horrific, this is a really important heavy metal that can cause severe neurological complications as well as skin problems. It is still very commonly found in a lot of skin bleaching agents, particularly those made in countries where mercury can still be added to cosmetics and medications. The dermatological complication is peeling of the hands and feet, and it's quite common to see this, particularly in children who are very vulnerable. Sadly, parents will bleach their children with that perception of not just beauty, but improving life chances. So again, if you're doing pediatric dermatology clinics, children with peeling hands, something's not quite right, maybe they've got an irritant dermatitis, do ask the parent if they're using any creams bought for, they might say it's cream to brighten the skin's child or to treat a rash, etc. And then when it comes to this page is just really summarizing, but we know that there are certain regions of the world where we're seeing more of the particular skin bleaching agents. So again, we're a global audience today, so just kind of being aware that you may be seeing people who've had been using mercury unknowing to them, pitching up in your clinics. So is there, we've talked about the harm to the skin, but it's also important to know that there's a huge psychological impact when it comes to skin bleaching. And studies have shown that the more you actually bleach your skin, the more dissatisfied you are, and therefore the more you bleach. So somebody might start bleaching, maybe they've seen a clip on YouTube or a relative has encouraged them, or maybe they're treating some post-inflammatory hyperpigmentation. They start to bleach, they start looking at their skin more closely, they notice darker marks, or maybe they notice that their skin is just returning to its usual expected skin tone, and they'll increase the bleaching and look for more and more potent skin bleaching agents. So when it comes to someone who skin bleaches, I think the important thing to know is they can be male or female. It really isn't just it isn't just a female or a woman's problem. And they can also be younger or older. People are having skin bleaching agents applied in childhood. Think of people who come from locations where skin bleaching may be normalized, even if it's not commonly talked about. If it's something that's happening often, think about that. Look out for that strange constellation of symptoms. So, the folliculitis with the dermatitis and maybe the stretch marks, complications of steroid and hydroquinone use. I would say not just for skin bleaching, but as anyone working in dermatology, it's really important to really spend some time asking people about anything that they have used on their skin and tell them to bring it in as well. Often people might be vague about the names of products they've used, or they just don't remember them. Also, sometimes people genuinely don't know that what they've bought over the counter or someone has given to them contains potent steroid or hydroquinone or a blend of botanicals that is actually contributing, causing, or exacerbating their skin problem. So do make sure that they bring things in or take photos. And I think it's also important to say that sometimes people start bleaching because they do actually have an underlying dermatological condition. So acne, melasma, they can coexist with the skin bleaching. So it's useful to know about, have they ever seen any other doctors for these problems in the past? So what can we do as dermatologists? I think skin bleaching really is a public health concern. It is a crisis. It isn't just a part of, a cultural beauty routine. It's important that people understand that some of the changes to their skin is going to be permanent and highly disfiguring. It's potentially teratogenic. It can be life-limiting at times if you get a Cushing's syndrome, for instance. And we know that when people are vulnerable, so maybe you're in an environment where people are talking to you a lot about what looks beautiful, or you're being bombarded with images, people will continue bleaching whether they know about the risks or not. So it's really important to understand that it's not as simple as saying, please just stop bleaching your skin. So as a dermatologist, we very importantly need to be able to make the diagnosis of complications and be able to manage any complications sensitively and in a timely way. Also be aware of things like steroid withdrawal can happen, which can mean that people's skin goes through a really traumatic stage of being much worse before it gets better. It's really important that we also treat any underlying skin condition. So if someone does actually have melasma and they've been bleaching to treat their melasma, please give the advice on using tinted mineral-based sunscreens, protection from photo damage. Try and explain that treating the skin condition is normal and healthy and important, and that's what we want to do, but actually bleaching all of the skin has huge important complications and health risks as well. And that education should wrap around everything. So you're not just berating your patient, you're also informing, you're mainly, not also, you are mainly informing them of the danger so that they can be well informed. I think it's important not to be judgmental. You want to avoid confrontation. So try and avoid saying, you're obviously bleaching your skin, I can tell. Do give skincare routines. And if you are doing a clinic where maybe you're doing a general dermatology clinic where time is very precious, you can standardize information leaflets to either physically hand to patients, or you can put it in the clinic letter where you give them advice on um, lifestyle and skincare of a range of budgets that can help minimize post-inflammatory hyperpigmentation. Um, and people can be really thankful because they'll see you as a healthcare professional giving sensible advice that is going to help them rather than hinder them. So we want them to look towards dermatologists for their skincare support rather than online influencers or someone in a beauty salon who may have ulterior motives in terms of selling them products. And finally, it's in the UK, and I would also strongly advise if you live in a country where skin bleaching agents have been banned, do try and either take a photo or keep the product if the patient will let you keep it, and let your local trading standard agents know that this product is being sold. People will, in my experience, people are often very vague about where they bought it because they don't want to get people into trouble. They become suspicious about why I'm asking them, where exactly did you buy this cream? But it is useful because often the labeling on these products is really poor as well. So people, when not that every trading standards place will test, but sometimes when they do test, they will find ingredients like mercury or arsenic or very super potent steroids as well. And then follow-up, I think it's always useful to offer at least one face-to-face follow-up for people who've been bleaching their skin. It allows them to get used to a new skincare routine, manage their skin underlying skin disease if they have one, but it's also a time to anticipate that they might relapse, so they might go back to using creams again. So it's that other time for you to give a bit more education to make, just as a reminder, to help prevent relapse. So knowing what happens in your local area means that you can build trust with the patients who are coming in to see you. So sometimes we live in East London. Um, we have a very diverse group of people, cultures, ethnicities. I know roughly the markets where you can buy bleaching agents, the shops, the barbers, the hairdressers. So sometimes I'll say in clinic, oh, have you ever bought? And then I'll mention some of the names of creams that I know have skin bleaching agents. And that's a way of, again, not showing any judgment, not saying to someone, oh, you've obviously used this, but they might be a little bit more prepared to disclose to you if you're able to say, have you used this particular cream? One cream that, or I think I've kept the bottle of it. It was called Michael Jackson Whitening Cream. And there was a bit of a spate of times of people buying this cream from a local salon to bleach their skin. One of my patients actually gave it to me, so I was able to ask people, have you ever used the Michael Jackson cream? And funnily enough, 2 or 3 times people would come back and say, oh, I thought about buying it. Oh, yes, I used it once, then I stopped. And that cream, interestingly, did contain mercury. The other important thing is do work with your network, so your other stakeholders, if you know local aesthetic doctors or cosmetic doctors, or people who are in the business, like selling cosmetics, salons, pharmacies, etc. It's worth just working with them to know that they shouldn't be selling these creams, who's coming in to buy them, are they getting a lot of students in, is it mainly older people, etc. Particularly your aestheticians, sometimes they won't have much of a dermatology training and they will be almost pressured into wanting to give hydroquinone and related products to patients to lighten the skin, because the patient is saying, I want lighter skin. So it's important that we work together collaboratively to make sure that people aren't kind of almost colluding with their patients or clients. It's also important to know your local area's legislation and trading standards. And finally, as we discussed earlier, share any concerns. If you know that there's a salon or an aesthetic clinic that's always, giving very strong treatments or treatments that are illegal, misusing hydroquinone and triple combination cream compounds, do share those concerns. And the main thing is in your areas there will be legislations which can support you. In the UK we have trading standards, and we are in this area expected to report potential drug reactions on a yellow card, and we should also be reporting the sale of banned skin bleaching agents, and the fine is £20,000 per offence and 1 year in prison. So it's really important. Nationally and internationally, I think it's really useful to work with whichever region you're in. If you have the opportunity, work with your skincare brands and your beauty brands and encourage them to promote a diverse standard of beauty. So you don't just always have the model has very light skin and has very Eurocentric features. You should have a range of models who represent the range of the populations in that area. In the UK, we have the British Beauty Council. It's important to also encourage the cosmetic brands to avoid kind of problematic skincare marketing. So the classic is showing the same person with the filter where the skin looks lighter or darker. Advertising agencies work alongside beauty brands. So again, in your region, if you could get to know or if you're ever given opportunities to work alongside advertising agencies, or even just approach them and say, look, I've noticed you're always your adverts often promote this particular beauty ideal, do try, you as doctors, you have a huge influence on how people will want to work to meet your doctor standards. So do try and use that influence that you do have. And I think it's important to also applaud brands that are trying to show diversity and inclusivity with different skin tones and skin colors, so that all these industries are about making money and promoting their brand. And if we are working with people who don't use skin bleaching in their adverts, in their promotional work, that almost gives a bit of a dermatologist stamp to what we think is acceptable. People still do a lot of what they want, but we've got to remember we're all influenced by what we see around us. And finally, we're a global audience today, so do get involved with international policy if you're able to. So finally, the answers to the quiz. So the first question, what enzyme does hydroquinone inhibit? This is just for your own, we won't get you shouting out the answers. So it's tyrosinase. And what is the estimated annual value of the global skin bleaching industry? 24 billion. That figure's probably not accurate at all, and I suspect it's probably much higher. And finally, in the UK, the prison term for someone caught selling skin bleaching products, it's 1 year in prison. So in summary, skin bleaching is the deliberate reduction of melanin to give a uniform lighter skin tone. It has been used since antiquity, so it's not a new phenomenon, but we know it has really important complications, and it's really important to understand that it's not the same as dyeing your hair. It is almost not akin, but similar to skin tanning. When people deliberately tan their skin, they can have the risk of getting a skin cancer, which can shorten their lives. When people deliberately lighten or bleach their skin, they can get lots of long-term complications that are incredibly disfiguring, and in extreme circumstances can be life-threatening. So that's it for me. Thank you so much. And do follow the Glowderm team on social media. And I'm now going to hand back to our Glowderm team for any questions. Jamila, are you there?
Hello, can you hear me?
Hello? Yes, I can hear you now.
All right, sorry about that. So, yes, thank you for the very insightful presentation. We do have some questions here. So the first question says, what advice would you give to people who are considering bleaching their skin?
So I'll take that question. I think it's really so almost like a summary of the talk. Skin bleaching has severe complications that can be permanent and disfiguring. Once you start bleaching your skin, you will not stop because of that that almost negative spiral cycle of you become less and less happy, and then you start bleaching more and more and using more potent products. It's also a question of why are you bleaching your skin? For many people, they may not be able to give you the answer. For some, it will be, I want to bleach my skin because I have dark marks, because I get spots every month that don't go away, and when they go away, they finally leave a dark mark and I can't get rid of it. But for a lot of people, it will be societal pressure, and that's a really important thing that we need to break. But in brief, I think highlight the severe complications and risks, and respectfully challenge the reason why they're doing it. If they say, I think it's going to give me a better job, or I looked at an advert and everyone had lighter skin, then it's really difficult for us to say, well, just stop doing it. I think we more have to focus on the risks and dangers to it, and just also how unreasonable it is to feel like you need to bleach your skin to move forward in life. We should be trying to counteract that.
Okay, thank you. So the next question says, how can governments and public health organizations better tackle the issue of skin bleaching?
Do you want to take that one? I think it's quite well. The main thing is regulation, and then working with stakeholders. So the public, statisticians, healthcare professionals, and really to get some guidance for education and regulation.
Thank you, Dr. Chiedu. Third question goes, thank you, speakers. Informative speech. I want to know how much amounts of and how long use of hydroquinone causes fetal growth retardation. If anyone is on use of hydroquinone for any reason, after how many days can she be pregnant?
Ooh, okay. So first of all, hydroquinone is contraindicated in pregnancy. So I would advise them, like if someone's planning a pregnancy, they shouldn't go on hydroquinone because they won't necessarily know when they get pregnant. If someone inadvertently gets pregnant, and this is the advice I always give to people, to women, if you accidentally get pregnant, you weren't planning the pregnancy, stop your hydroquinone product straight away. The risk of fetal retardation or restriction with hydroquinone is from the persistent use of the hydroquinone during the pregnancy. So this is, you are pregnant and you are using it throughout pregnancy, rather than you used it and then you stopped as soon as you found out you were pregnant. So you're unlikely to cause problems if you stop once, after 4 weeks of, after the first missed period or the pregnancy test. In terms of washout periods from the body, it's difficult to know because hydroquinone is a topical cream. So it's not something that's ingested, and we don't have blood tests that show us that it spikes and then washes out. With anything topical, I would usually expect it to be on the skin and penetrating through the skin layers. Hydroquinone, the other important thing is it's not great at penetrating the skin, which is why often it's combined with something like tretinoin, which can help the penetration. So usually after 2 to 4 days, you shouldn't really have any left on the skin. So if someone is saying, I'm going to start getting pregnant in a month, they should just stop their hydroquinone and they'll be fine. I don't think you need a big long washout period. I would say, to be on the safe side, 2 weeks. The other thing to say is, with any skin bleaching or cosmetic things, in women of a childbearing age who are not using contraception, 1 in 4 pregnancies will end in a miscarriage. You don't want to be the doctor who said, oh, use this cream, then the patient miscarriages and says it's your fault, even if it's nothing to do with the cream. So I'm always very, like, quite strict, saying I'm starting you on, if I'm treating melasma, I'm starting you on products that you must not use in pregnancy. You must use effective contraception. If you choose not to, you could harm a pregnancy. And then it's up to them, but they've been told, and always document that as well.
Thank you, Dr. Sommerlad, for the very elaborative answer. The next question says, how long can one expect to get their original skin tone back after they stopped using skin bleaching products?
I think that's hard to say. Each individual is very different. So it just depends on the individual, fortunately.
So maybe how long would we guess? Maybe a month to 3 months?
So when it comes to the body making eumelanin and giving the skin tone, the melanocytes they want to make it. So once you stop using the topical skin bleaching agents, about between 2 and 4 weeks, those melanocytes will wake up again. Now, if you live somewhere very sunny and you're going to get the sun hitting the skin, that will drive even more production of melanin. So you'll notice within a month or so, your skin tone really very quickly coming back to how it originally was. If you live somewhere where you don't get very much sun, it might take a little bit longer. But the things like hydroquinone, it's reversibly switching off an enzyme. It's not a permanent stop of the enzyme, which is why you need to keep bleaching in order to maintain the bleach. So I'd roughly say, if someone's bleaching somewhere where you've got a lot of sunshine, probably within a month, they will see their skin returning to normal, maybe even sooner. It can be very distressing because that can return to normal in a non-uniform way. So they might get patches where some bits look darker or some bits look lighter. And that's where using photo protection, so a hat, sunscreen, not lying out in the sun can help so it's a bit more even. So do warn people that your colour will come back, provided you haven't got any permanent complications, but it may not be totally uniform.
Thank you very much, Dr. Sommerlad. The next question says, thank you. Some of these steroids, like betamethasone and clobetasol, are frequently used in managing some skin conditions. What precaution action can help providers tell patients or to avoid due to skin bleaching?
I think the best way often is the way that you treat most patients. So you provide them clear instructions into how to use their topical steroids. Because we know that topical steroids, if used misused, can always cause harm. So be clear, give them a clear time limit, a weaning regime of how to use topical steroids, and ensure that they know that if they misuse it, these effects can happen, and so they should be aware to stop it if they notice those changes.
Thank you. So Shamsun Nahar has a second question saying, how an individual can know whether her used products contain mercury or lead, as it does not mention in its literature ingredients, I guess.
So it depends. I'd love, which region is the person, the question? So basically, depending on your region, should really, if something's being sold in a pharmacy, it will, or a shop that is under regulations, then everything should be listed the on the ingredients list or the INCI list on the back of the packaging. The problem comes when you start buying things from non-regulated areas. So maybe under the counter, the hairdresser selling you a cream from the back of the shop, or you've gone to the local market, someone saying they've made it up, they've cooked it in their kitchen, then it's impossible to know. So I always recommend people buy things from reputable shops, because these people don't want to get fined. They don't want to go to prison. It's not worth the risk for them. They're making money from selling moisturizers and soaps and toothpaste. If someone has a skin condition like melasma, acne, then they should be actually under the care of a doctor, and those prescription medications, again, they are tightly regulated. So although it's not uncommon to hear that sometimes things have been contaminated and there's a recall of products, in many countries, arsenic is totally banned. Like, it is absolutely no. I think there's very, very few countries where they put it. In mercury, it's a surprising number of countries. It's you can get it in parts of the Caribbean, Bangladesh as well. But usually there's strong regulation on how much mercury is in the product. So in short, they buy cosmetics from reputable places, avoid buying them online, especially if they're sold as, quick fix skin lightening product.
Thank you very much, Dr. Samalet. Another question says, some French products in this regard have been available in Egypt. I have noticed their change of policy, and they are using safer products such as topical vitamin C. Have you noticed similar changes in the private medical sector in the UK? This is from Gohar from UK, currently based in Egypt.
Yeah, so in the UK, there's the strict regulations. So no hydroquinone can be purchased over the counter for over 20 years. There's a prison sentence and the kind of quite substantial fine. I think the problem is there's a lot of products usually sold online which have a lot of botanicals in it, so kojic acid, arbutin, azelaic at high concentrations, and and steroids to boot. And because they're being sold online, and online is like the Wild West, people are able to get hold of these things, and they will come to clinics saying, I use this cream. So the regulation is out there, but it's just enforcing it is difficult. I think more of the more widespread big cosmetic companies are actually developing their own tyrosinase inhibitors that are safe and not bleaching. They're only targeting hyperpigmented areas rather than uniformly lighting. And I think there's also a move for more inclusive sunscreen so that people who do have melasma, post-inflammatory hyperpigmentation, just want to avoid premature aging, they can use those things and not feel like I have a tan now, I need to bleach the tan away with skin bleaching. But the things are still available, they're still out there.
Thank you for that. I have a question of my own. Is there no safe way or less harmful way of skin bleaching?
No. No. It is your skin color is genetically predetermined. So until someone can create a vector that you take that switches off the amount of eumelanin your melanocytes make, your body will want to make you that shade. So I think the question maybe is there a way of preventing your skin from darkening, from being darker than it's meant to be? And we know that's the usual photoprotection, treating underlying skin disorders. And photoprotection could literally just be wearing a hat on a sunny day. But there isn't a safe way to switch off the way your melanocytes want to make and package and distribute eumelanin, because that's the way you are genetically made.
All right, thank you very much. I can see no more questions from the question and answer section, nor from the chat. I also would like to thank you, Dr. Ufodiama and Sommerlad, for the very, very, very nice presentation, very elaborative. And maybe this could be the end of our presentation for today, skin bleaching and complications. Thank you again. Thank you, panelists, for attending. Thank you, guests all over the world for attending. Thank you very much.
Thank you.
Thank you. All right. Take care. All the best.
Bye.
Bye-bye.